So, healthcare marketplace, a couple of words that scare you, that make your eyes glaze over, that make you wonder, what am I going to do this year? Today, we've got help. This is Focus. I'm Anna Marie De La Vega, and we're talking with Aida Whitfield, the director of the Get Covered Tennessee program at Family and Children's Service. She's joining us today. Welcome.
Thank you.
Oh, we need your help today.
I'm glad I'm here.
I am too. So we're looking at making changes during the open enrollment for healthcare marketplace. Could you kind of give us some ideas on like how to get started, what to look out for, what are we trying to make sure we get covered, that sort of thing?
Yes. So in order to start, as you all, as most people know, open enrollment is a set date. Mm-hmm. So usually marketplace open enrollment starts in November 1st and it ends January 15th. One of the things I want to mention is that there's also one deadline in between November 1st and January 15th.
What?
December 15th is one deadline. That is if individuals want to enroll and get coverage starting January 1st of 2026, they need to enroll within November 1st and December 15th.
Okay.
Yes. But if they decide to wait further long and enroll, let's say, in December 16,
mm-hmm.
their coverage will start February 1st.
So they need to see what coverage they have and how long that's going to last.
Right.
Before they decide to, so they don't have lapse in coverage.
Yes. So everyone who has marketplace plan,
mm-hmm.
their current coverage will end December 15.
Oh.
So, yes, we always try to bring people's focus into that December 15 deadline.
That's
because
good.
You need to finish everything, enroll, and pick a plan before December 15 in order for you to have a January 1st, 2026 coverage day. But again, open enrollment won't end until January 15. Mm-hmm. But if you rather just don't care about having the gap and wait and then do it maybe after December 15, you still will have coverage, but it will start in February 1st.
So if our coverage ends December 15th, we really should like do it as soon as it opens.
Yeah, if coverage will end in December 31st for 2025. So you definitely need to start looking into plans, what works best for you, what covers you, mm-hmm. what fits your budget November 1st. Mm-hmm. And that will give you enough time to find whether the plan is covering your doctor, is it in network, is also covering your prescription. That will give you enough time from November 1st until December 15th to make a decision and a pickup plan. And then you'll start your coverage January 1st, 2026, so you won't have any gap in between your coverage.
And you called it a pickup plan?
Pickup plan.
Oh, pick a plan.
Yes, pick a plan.
By all means, pick a plan. And so we're looking for, how do we look for one that has coverage for our current prescriptions, our current doctor?
Yes. So there are several different ways that you can do that. One, you can do your own research by going to healthcare.gov website. Just make sure it is healthcare.gov. And there's see plans and price. That way you will do a window shopping. So you plug in few information, your zip code, your household, whether you have a dependent or not, whether you're married or not. Mm-hmm. And then you will enter your estimated income for 2026. As you all know, Marketplace always asks for your projected income.
Oh.
So based on that, it will give you all your options. So you can look at the plans. You can also plug in your doctors in there. It will give you that option. You can plug in your prescription. And when you look at all the plans that are available for you, then you'll be able to see if the doctor is in network. It will have a check mark next to it. And also you will see all the prescriptions that are covered within that plan. Mm-hmm. The other also way that we tell our client is that if you have a set doctor, a set hospital, and if you look at the plans prior to going to your doctor and say, hey, I looked at this plan and I'm interested. I can afford it. It looks like a good fit for me or for my family. do you accept this plan?
Okay.
We always tell our clients to go back and make that research, kind of give them homework. That way, because plans change a lot, facilities change network, doctors drop, one of the plan that they had last year going this year. So we get more clear information from the doctor office which plan they accept. So that is one big homework we always assign to our client.
Yes.
And we always ask them to do that. So
I noticed that one of my husband's doctors changed jobs. Like he went to another medical group.
Okay.
And so that was outside of his plan. And we were like,
Yes.
oh, no,
Yes.
now what? So that's the kind of thing you do need to ask your doctors about. You want to keep the specific doctor,
yes.
then say,
Ask
I'm
them.
interested in this plan. Do you accept that?
Yes, exactly. That's the exact thing that we ask people to do.
Okay. Are there places online that we can get more help if we need it? Or do we, I know that Family and Children's Service does help people
Yes.
find plans. Do you kind of
Yes.
do that process if we're like, I'm not that great at using
Right.
online services?
Yes, so that is one of our job. We are funded by the federal government to do exactly that. We help people, we sit with people and go through their plans and then show them what is in network, what is outside of their network. We talk to them about, does this, fit your need, like obviously prescription coverage and network adequacy. And the other thing is also, does this, can you handle the premium for this plan?
Can you afford it?
Yeah, can you afford it? That's one of the main things we share with them. And if not, can we look at different plan? Maybe it is in your budget. So we go over that and then help them pick the plan. Obviously, we are, again, funded by the federal government, so we can't tell people, oh, this plan looks good for you. But we give them all the information they need so they can make the final decision on what plan works for them. So they will be the one who choose and decide, oh, this looks good for me based on the information you gave me. So I'm going to choose, one of the carriers that they like.
Aida Whitfield is the director of the Get Covered Tennessee program at Family and Children's Service. I noticed you have an accent, and I was thinking about who tends to come and need some help, because I can imagine maybe older people and maybe people who don't have English as their first language.
Right.
It's so confusing
Right.
to people who do have English as a
Right.
first language. Do you tend to get people who need that extra kind of translation from younger to older or from English to another language?
There you go. All that. So we have clients, obviously who are, originally from here, grew up here, but didn't have insurance because they may have insurance through their job. And all they know is just paying that monthly payment,
Yes.
but didn't have a whole lot of idea about, is it covering me fully? And do I need it? Do I not need it?
Yes.
Is it meeting my family needs as well? So they'll come to us and it will just be brand new information for them.
Yes.
Because that usually the employer plan are like picked, maybe 3 or the max 4 you have. So you choose just one of the, the plan that seems good without really understanding you fully. On the marketplace, you sometimes get 60 and more plans to choose from. So that is really confusing for
Yes.
anybody.
Yeah.
And then also, as you mentioned, we have a lot of families who are getting insurance for the first time because maybe they're from a different country who never had insurance in their country, or maybe they have just a universal insurance where they didn't really have to do much
Right.
to get it. So here we are having to translate what is deductible, what is premium.
Yes.
So all those little details that we have to share. So we have an interpreter that we use internally. We also contract with outside language services. So we bring in a different interpreter if we can't have it within the house. And we help individuals in their own native language and with an interpreter. And we also have our own bilingual staff, including myself. We help them with their own language. So that is the perk about our program, I think.
And I think also a perk about the program seems to be that you truly care.
Yes. Obviously, a lot of us have done the work for a long time. And we're called navigators. And it's not an easy job, honestly, because, really at the end of the day, you have heard so many sad stories about people who cannot find a plan or who are not eligible or who cannot afford it. It's really like kind of sad and draining, but we're obviously are focused on making sure our community knows the resource and get the help that they need. Unfortunately, just recently, we have lost our funding, almost 90% of our funding, unfortunately.
Gosh.
And we have to let go almost about 30 navigators. So
out of how many?
We had 37. So now we're really down to 4 navigators. So one main thing I want to mention is if you're interested in getting that one-on-one assistant with a local agency, please make your appointment now. You can go to our website. It is GetCoveredTennn.org. Again, it is GetCoveredTennn.org. And also, you can call our 800 number. It's 1-866-475-7879 and schedule your appointment.
GetCoveredTennn.org, because that'll have the phone number there as well, right?
Yes.
And so we better get to it right now if we need an appointment and need some help.
Definitely. We're getting fully booked already for October. We're halfway booked for November. So definitely encourage people to go and make their appointment.
If people are trying to do it on their own, Aida, have you seen maybe some mistakes that they've made that you can help the rest of us steer clear of?
Yes. So most of the time, what we see is income questions that are being answered wrongly. That is because the marketplace asks for projected income, which is so difficult, especially for, a lot of people here do a small gig, self-employment. It's so hard for you to project what you would make at the end of 2026, obviously. So we always ask people to be close to what you project, what you would expect to make, one. And then also know that you can make updates on your marketplace on the income section throughout the year. So just make sure, one, if you have any idea based on your previous tax record, if you feel like, this is what I've done, this is what I'm going to continue to do, so my income will be around this time, project it based on your previous tax record. If not, just do an educated guess, but make sure, put it in the back of your head. If anything changed, you need to come back and update the income, because the tax credit that you receive through the marketplace is related to your income. It's based on your income. So if you say 30,000 and at the end of the year you make 60, then you have to pay back the tax credit that you receive. So just be mindful of what you project. If you project high, and obviously and then you expect to make low, you still can come back at any point throughout the year and edit your income, update your income. But just make sure you estimate somewhat close to the reality of your situation.
So if you estimate high and then you're not making that much money and you get to the end of the year, what happens?
Good question. So what happened is this is really then it would be more involved with the IRS. So IRS will pay you the difference back, because at that point you're supposed to get a lot more tax credit, but you didn't get what you are supposed to because you overshot your income. So you get money back as a tax refund.
Okay.
Yes.
Or like I did the first year I got on healthcare marketplace, after being full-time employee for a long time and then going to part-time, I underestimated.
Yes.
And at the end of the year, I had to pay more taxes.
Right.
I was like, wait a minute, but I didn't know.
Right.
You probably told me, but I didn't know I could go back and adjust any time.
Yes, you can adjust. The other thing too, when you submit the application will ask you, do you want to take the full tax credit or do you want to adjust how much you're taking? So if you want to take the full credit, obviously you're saying, I'm certain my income is going to be this much. But you have the option to take less. That means you would pay out of pocket more, But as you mentioned, if you end up making less than what you said on the application, you always get that money back. It's just the issue is obviously underestimating your income and then making a lot more at the end of the year.
That's where you'll kind of get messed up.
Right.
So what? Let's tell people what the deduction is and how the IRS is involved in this.
Right.
Because basically you're saying, I'm going to only earn this much money, and then how does the healthcare marketplace, what is the tax credit thing?
Sure. So the tax credit is what you would be eligible for. That's the perk of obviously signing through the marketplace.
Mm-hmm.
You get the tax credit. But tax credit is based on your household income. So if your income is somewhat too closer to the lower part of the poverty level,
mm-hmm.
you get higher tax credit. If your income is higher, closer to the 400% poverty level, then you're not really seeing a whole lot. But this mostly affects people who are in between that 100% and 400% of the federal poverty level.
Because they're trying to make sure that everyone can have insurance. So if you don't make enough money, they're trying to give you enough of a tax credit that you can still get that insurance for a low cost.
Right. Exactly. That's the main purpose of the tax credit. So it could be a little bit affordable.
Yeah.
To
because heaven knows it's expensive.
Very much so.
I looked into, and when you leave a full-time employer, you need to know this. Even if you hear that when you leave, you can extend your coverage. It's not just extending your coverage. It goes up like 600% or something. It's outrageous.
Yes.
Like that, we're talking thousands of dollars more just to get health care coverage.
Yes.
So you need to be ready to deal with the healthcare marketplace.
Right. And then especially, obviously, we're expecting a lot more increase in premium going forward for 2026, especially if the decision as far as whether the enhanced subsidy is going to be applied based on the decision from the House.
Mm-hmm.
If they allow that to happen, obviously we will see some reasonable price. But if that enhanced subsidy goes away next year, we're expecting to see a higher premium for marketplace plan.
And the enhanced subsidy, is that something left over from the COVID era, or?
You are correct. Yes, that was part of the American Rescue Plan Act that was implemented then to help people, as you say, make it affordable for a lot of people to obtain health insurance. So current discussion is that would be taken away. People still get some tax credit, some discount, but it wouldn't be enough.
Yeah.
From my understanding of working in this field for many years.
Yeah.
So people will see a lot of higher premium compared to their last year's plan.
What will they do? What will we do?
Right. Good question. Really at this point, the one main thing that we're sharing to people is just obviously find resources in your community. One of those are, federally qualified health centers. They are not a doctor office, obviously. They are out there to serve the community and provide, basic medical care. But again, this is a difficult conversation for those who have medical issues, because they're not easily able to just leave an insurance company that helped them pay their bill for their, medication.
Their specialized medication.
Right.
Possibly,
so really at this point, it was just so hard for us to even figure out what would be the news that we share with our clients. Now that they come back and we're telling them your plan is now, $200 more than what you paid last year. So really it's just a situation that we're in that we really cannot figure out what to do, what to say.
And you said they're federally qualified health centers. I have started to see those open up and pop open. So that would be something that possibly we should look into no matter what as part of our homework?
Right. I think so, because the reasoning is that we are expecting people to be uninsured. We're expecting uninsured rate to increase in our state because people will just rather not have it than have it and cannot afford to pay for it, right?
Yeah.
For some clients, that's the case. And we've seen people really go at price first rather than even looking at, would I need this? Would it cover my, x-ray for my broken arm last week? So people look at the price first and they make a decision whether they want it or not. And we've seen even previous years, if the price goes up, maybe even like $10, $20, people will say like, hey, I don't want it.
Mm-hmm.
And then even though we're continuously expressing the need because of, any emergency, you don't have insurance, then you'll be even in a worse position than you are with it.
Yeah.
So we explain to people the importance of having health insurance. But obviously we see a lot of people, young people especially, saying, hey, I'm healthy. I don't need this. I was able to afford it last year. That's why I have it now. Now I don't need it. I'll be okay. I'll just go to the walk-in clinic.
Mm-hmm.
That's what we are expecting to see. And really, we are not sure in what to direct people. Definitely there will be a catastrophic plans that will be available for next year. We definitely would look into that and help them find what works best for them. But as you know, those plans have a very high deductible.
Oh.
So it's not very appealing for a lot of people, honestly.
Right. So a catastrophic plan, meaning what? What would that mean?
So catastrophic plans will have very low monthly premium, very high deductible. So this is something that you will have just in case of emergency. Then I know my cap of expected expense, and the insurance may pay it after that. So sometimes it would be like your deductible would be $10,000.
Right.
So this is just, again,
if you got 10 grand, but not 210 grand.
Then there you go. That will help you. And it usually covers 3 primary care visits per year without touching the deductible. It also meet all the minimum essential requirement, whereas like if you need vaccination, you can get vaccination without really going into the deductible. Those are the the perks of the catastrophic plan.
Right.
Other than that, really for any regular medical care, any routine prescription you need, then that would not be a best option.
Yeah, you're on your own with that.
Right.
And you're they're hoping that possibly you can get a coupon from somebody. I know that's become an option where people get from apps or from companies a coupon that they can show at their pharmacy to get prescriptions at a lower cost, things like that.
Yes. I mean, people are becoming more savvy. I hear from people, even with their insurance, some company would not cover a prescription if you have insurance.
Yeah.
But some company allows, even though you have insurance, they know some of the prescription may not be covered by insurance, so they give some kind of discount program directly with the company, with the manufacturer.
Oh, yes,
and
yes.
as you said, coupons are good. So any resources you can find to help reduce the expense will be something to kind of keep in mind.
Is there a list of things like that to look at on the GetCoveredTennessee, GetCoveredTennessee.org?
So we have basic information, not specific, because as I mentioned, this is the year where we are seeing all this change come at once on us. So we're really at this point trying to figure out what information we need to share to our clients, what resource we need to have. So we have resource on our website. It may not be specific to the current situation, but just general resource. How do you find local federally qualified clinic in your area?
Okay.
Those kind of information are on our website.
That's good, because that gives us a place to get started.
Right.
And it is going to take some people kind of digging in.
Yes, a lot of digging in, to be honest. Again, for a lot of people who are not really sick, they only need the insurance when they need it, when they are sick. So this is something that they need to start looking forward to knowing more.
Yes.
So then, now I have to take things into hand. And then, if I get sick and I don't have insurance, where do I go?
And where am I going to get that money?
Right. Exactly.
Because it'll cost a lot more.
Yeah.
Okay. So those are kind of mistakes to make, to not think you need it and not get it and to not do your homework.
Mm-hmm.
And now if the Get Covered Tennessee program at Family and Children's Service is more limited for appointments, do you have other resources where you can send people, like these people can talk to you, these people can talk to you, and kind of help guide you through it? Or
Right. The one thing I will say is still use the resource with the marketplace. So marketplace have a, direct toll-free number. They're open 24/7 so that they know enough information to guide you through the application process. So
really? Good.
yeah, those don't disregard those marketplace toll-free numbers. So call them, and they tend to reach out close to open enrollment. They email you, they call you in some form. Sometimes they text you if you allow text message to be a way to communicate. So, make sure you keep those numbers and then call during open enrollment and then talk to anybody there. And then if you don't feel like you got the right information, call back again. There, you have no idea how many people you talk to and you get different information. And you find that one that knows most everything. So
yes,
don't just discourage and stop at one phone call. Just try to reach out and find the information that you need. They definitely could guide you through the application process. They can submit the application on their end and tell you what plans are available for you. So you can do that. But again, I would like to go back to that window shopping tool on healthcare.gov. That will give you a better understanding. So when you call them, you're not lost and they're, them blindly guiding you.
I see.
What to ask, what to look for. You have already picked out the plan that makes sense for you. So you can specifically ask questions about those plans.
Yes.
So I definitely say to do your homework using that window shopping tool on healthcare.gov. The other resource, as you said, is a lot of this federally qualified clinic have certified application counselor. We call them CACs. Those people are trained and licensed to help people find coverage through the marketplace as well.
Oh, wow.
Yes. But the issue is this certified application counselors have other jobs within the federal qualified health clinics. So they're not sitting there waiting for an individual to come so they can help them apply. So what you need to do is really, if there's a federally qualified clinic in your neighborhood, in your area, across the state, obviously, reach out to them and see if they have any CAC or certified application counselors to see if they're available to help. So if they are, that you can sit with them, schedule an appointment, and talk to them and get information from them.
We're finding with so many changes going on right now that it is harder to get in touch with a real person.
Right.
And so you kind of just encourage us to really reach out. Don't wait for somebody to reach out to us.
Right.
And use all the resources that you have.
Right.
Okay. Anything else that you feel is important to add, because we're almost out of time,
Right.
that you feel that people just need to know about, or to be encouraged to try and not give up?
Yes. So, again, open enrollment starts in November. Make sure to start kind of looking at the plans early.
So
Just,
now.
Yeah, now. I mean, don't wait until the last day, because obviously it would be difficult to find a person local to help you, like us, or even the marketplace will get bombarded by calls. So then don't wait until the last minute. Do your homework and start looking at plans starting November, and then decide what you want to do. One. The other thing I want to mention is that just don't get discouraged, again, because you can find some help by calling the marketplace directly. And again, try to reach the local assisters like us with Get Covered Tennessee, and also the application counselors through the federally qualified clinic are also could be another resource. The other one more thing I want to mention is on healthcare.gov, there is a link that say find local. So if you find that and click that link, it will show you just a list of agents and brokers who actually work to help people. But the one thing obviously I want to mention are these individuals are paid by the insurance company, so they usually tend to kind of guide you to one plan that they want you to purchase. But again, If you know the plan that you want and if that agent is selling that one plan, then here you go. You get the free service, and then he gets his commission, and you get the help that you need. But again, these are just extreme measures that you can take if you're not able to find anybody local to help you. Okay. But again, utilize the healthcare.gov toll-free number. Try to get in touch with us, Get Covered Tennessee, and then the Federal Qualified Clinic have application counselors. And then also you can find local agent and brokers in your community too. That's
beautiful. Thank you for that wonderful advice.
Oh, you're welcome.
That's Aida Whitfield, director of the Get Covered Tennessee program. GetCoveredTennessee.org if you want more information. We'll also put some links on our Focus Facebook page. Please make sure you join us again next week. I'm Anna Marie, and that's Focus.